I'm Brittany McGinnis. I'm a nurse practitioner student at Auburn University, and this is my suture demonstration video. Once I've determined that a patient requires sutures to close a wound, I want to make sure to clean the wound very well. I need to assess for any allergies to skin cleansers or anesthetics before getting started. For purposes of this case, this patient has no allergies. I will then proceed with copiously irrigating the wound with diluted CHG or betadine. Once the wound is clean, I want to ensure that the patient is in a comfortable position and that the wound is placed in a clean, dry area that is well lit. Once anesthetized, I may also want to remove some of the dead fragmented edges from the wound. Doing this, as well as the cleaning, will reduce the risk for infection and allow for better healing and a better cosmetic result. Now the patient is ready to be anesthetized in the wound area. There are two topical options, LET and EMLA. Those are applied to a cotton ball and applied directly to the wound bed, and they are absorbed through the wound to allow anesthesia. The injectable options are lidocaine with epinephrine, and bupivacaine. Both of the lidocaine options have a rapid onset. Plain lidocaine is available in 0.5, 1, and 2% strengths. Lidocaine with epinephrine is available in 0.5 and 1% strength. You have to use caution with this medication because it does cause vasoconstriction. You do not want to use lidocaine with epinephrine in the areas of the fingers, toes, penis, nose, ears, or the eyes. This can cause vascular necrosis of these areas. The last option is bupivacaine. It has a slower onset, but it does have a longer duration than lidocaine. The maximum dosages for these medications are lidocaine 5 milligrams per kilogram and bupivacaine 3 milligrams per kilogram. To inject these anesthetics, you would need a needle, 25, 27, or 30 gauge bore, a smaller bore needle, and a syringe, and your vial of chosen anesthetic. As stated earlier, this patient is not allergic to any medication, so we can choose any of the options. You would want to draw up your anesthetic into the syringe and then ensure that your wound remains clean. You would insert the needle into one edge of the wound bed along the edge of the wound and then aspirate the syringe to ensure that there is no blood return, meaning that you would be in a vessel. Without the blood return, you will slowly inject the medication as you remove the needle. You can then insert the needle into that area that's becoming numb and inject the other direction of the wound, covering all areas of the wound, making sure that the whole thing is numb. To test before getting started, you can use the tip of the needle to just touch around the wound to make sure that it is numb before you get started. Discussing different suture options, there are absorbable and non-absorbable options. Today I will be using a non-absorbable monofilament option. So with each of those, you can have braided or monofilament suture material. The absorbable sutures, you are more at risk of inflammation, but they do dissolve and they aren't required to be removed, which is helpful in certain cases. The non-absorbable sutures are typically stronger and they do not cause as much inflammation, and they do have to be removed. The monofilament versus the braided does cause a higher risk for infection. It can be an easier material to work with, but it's just a risk benefit, what you think is most appropriate for the wound. So I will get started here with my suture demonstration. I'm going to adjust the camera here. You can see my wound. So I'll be working on this wound here. I'll be doing 5 simple interrupted sutures. These are used for surface closure, and it will evert the wound edge. So here I have my suture material. And like I said, I'm using the monofilament, which is going to be stronger than that braided option. I have pickups, a needle driver, and a pair of scissors. So ensuring that my patient is numb and that the area is still clean, I would perform hand hygiene and apply sterile gloves before beginning. So I'll use my needle driver to grasp my needle here. Well, and my suture material. And grab the base of the needle, not the sharp edge, to load it in my needle driver. So I'm going to start here in the middle, pick up skin, insert the needle, and pick up the other side, and exit the other side of the wound. Pulling the needle through until all that's left is a short tail of the suture material here. Tying my knot, I'm going to place my needle driver here parallel with the wound bed, wrap this twice, grab this tail, and pull it to the opposite side. Wrap again, pulling to the opposite side, and once more putting at least 3 throws in my suture material. You would normally do these in the rule of halves, but since I'm doing an odd number, I'm just going to split the difference of each side. Picking up the skin. Wrapping twice, pulling to the other side, wrap once, that's 2. As I continue these last 3 sutures, I can discuss some of the aftercare that I would conduct and teach the patient. When done with suturing, I would clean this site with normal saline and then apply an antibiotic ointment such as bacitracin if the patient was not allergic. And then a sterile non-adherent dressing. The patient should keep that dressing on for 24 hours. ensuring not to get it wet. Want to keep this wound dry and as clean as possible. Once this original bandage has been on for 24 hours, the patient can remove it, clean the wound themselves, reapply the antibiotic ointment, and cover it back up. Especially in the summer months, you want to educate no swimming pools, no lakes, no submersion in the bathtub. Which that goes for all times, but especially in the summer when people are on vacation. It's hard to say no to the swimming pool. They should report any signs of infection, such as redness, swelling, warmth, oozing, bleeding. Systemic signs would be fever. And then, since I'm using a non-absorbable suture, the patient would return to have these removed, depending on what part of the body this is. If it were the face, they'd come back in 4 to 5 days. If it were the body or the scalp, about 7 days. And then the palms, the soles of the feet, or on the back, they'd return in 10 days. I dispose of my needle in the sharps container. And as I said earlier, clean this site with normal saline, apply the antibiotic ointment, if not contraindicated, and a sterile and non-adherent gauze. So there are my 5 simple interrupted sutures. And that concludes my suture demonstration video.